Good afternoon, everyone, and welcome to the Multicultural Media Online Forum hosted by New South Wales Health, Multicultural New South Wales, and the New South Wales Multicultural Health Communication Service. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and we welcome you here today for the COVID updates from Minister from Multiculturalism, Natalie Ward, and Deputy Chief Health Officer, Marianne Gale, Dr. Marianne Gale. Thank you so much for joining us again here. Before we start, we'd like to acknowledge the traditional owners of the land in which we're all meeting today. We pay respects to elders past and present, and also acknowledge the elders from the multicultural communities represented today. And we'll get started. And please, just a reminder to please keep your microphones on mute, and please send in your questions on the chat and we'll make sure that we answer them. So we'll move ahead and start with Minister Ward. How are you?
I'm great, thank you, Jess. Good to see everybody again, and it's wonderful to be with you. I'm coming to you from Parliament today because we're sitting, so please excuse me if the bells do ring. I will try to go on mute as quickly as I can, but we anticipate there might be a few divisions coming up, so I'll just need to deal with that. So please excuse me in advance, but it's great to be with you all again. I really look forward to our weekly conferences, and it's great to see everybody joining in again. I'm looking forward to your questions. Of course, I acknowledge the traditional custodians as well of each of the lands on which we meet and pay my respects to elders past and present. For me here in Parliament, that's the Gadigal people of the Eora Nation, and I thank them. So I've spoken many times about the New South Wales Government's urgent response to our COVID pandemic, as you know, but in particular about my job, which is to make sure we get support out to people. And one of our priorities has been to get that money out the door as quickly as possible to get it to those who need it most. And this week I was delighted to announce that 14 non-government organisations will deliver that much needed help and those essentials to our vulnerable temporary visa holders, in particular asylum seekers, because we heard from you that they were particularly vulnerable and they needed help and support, and we're very pleased to be able to have delivered that to the NGOs that will help them. That's possible due to the $5.5 million funding package that was approved by the government, and I'm really pleased that we've gotten that through and out the door quickly. That money will be used for emergency support and care for much needed essentials, food, cleaning products, essential transport and medical support. And they're really important, including housing, utility costs, as well as culturally appropriate caseworkers and translation and interpreting services, of course. We've heard so much about how important it is to hear information in language from trusted sources. So I'm really pleased that we can be supportive of those wonderful translators and interpreters and those services that they provide. Because we know that asylum seekers in particular, who are already amongst our most vulnerable, have been greatly impacted during COVID and the current Delta outbreak. So this support is aimed to help them pay the bills, keep the food on the table, and get access to that critical medical support and care that we know they need, and we want them to access as quickly as possible, but they can do all of that in their native language, which is so important. We know those organisations as well have experienced a steep increase. We've heard from them, a huge increase in demand during the current outbreak. And I'm delighted to call out a couple of them, if I may, Jess. I just want to thank them for their wonderful work and say that some of the successful recipients are Fairfield Community Resource Centre, Community First Step, Lebanese Muslim Association, Jesuit Refugee Service Australia, JRS, the Asylum Seekers Centre, House of Welcome, Western Sydney Migrant Resource Centre, United Muslim Women's Association Incorporated, CCA New South Wales, Hills Community Aid and Information Service Inc., Settlement Services International, Multicultural Youth Affairs Network of New South Wales, Australian Red Cross, Host International, and the Salvation Army, the Salvos. So I'm just delighted that we can support all of those amazing organisations to keep doing the vital work that they're doing. I'm absolutely chuffed that we have now passed that 80% fully vaccinated mark. Fantastic work, everybody. Those who are fully vaccinated can now enjoy more freedoms. And in particular, I'm so pleased that community sport is back. So many of our groups can get together now, really important. You can also have more visitors to your home, which we've been talking about, I know, for a number of weeks, and really great that we can welcome family and friends back to our home. And of course, for those parents of school kids out there, the welcome return to school for our kinder kids, year 1s and year 12s. with the balance to follow this coming Monday. So it's great to be getting back into our rooms and feeling like life is starting to return to some sense of humanity and normality. And I hope that we all are feeling a little bit more comfortable with that. But if you're not feeling comfortable, that's fine too. It will take time to emerge, and please reach out for help if you're feeling anxious about the return or your community is. Can I urge everyone to keep promoting the vaccination message, please? We can't wait to hit that 90% mark. That will really make the difference in the last stretch that we go to. And I'm confident that we can go even further than that. So please, we've done great work. Continue what you're doing. Continue getting the message out to community. Get the vaccinations out there. Stay safe and follow the rules. And soon we'll be having these media conferences where we're talking about something other than COVID. But in the meantime, I just want to thank everybody for their great work. And I'll hand over to back to you, Jess. Thank you.
Thank you so much, Minister Warden. It's good to hear all those organizations are receiving that support and all their great work as well. Dr. Gale, how are you today?
I'm very well. Thank you, Jess.
We have some updates.
I do. So good afternoon, everybody. Nice to be here again. And I hope you're all keeping well and enjoying these days, even though they have been a bit rainy. But I hope that you have been catching up with family and friends and getting out and about a little bit, but of course, doing so safely and within the rules. We're really pleased in New South Wales Health to see people continuing to come forward for vaccination across New South Wales. There's now almost 12 million doses of vaccine have been administered, which is really a remarkable achievement, and congratulations to everybody involved in that effort, and in particular to everybody in the community who's come forward to get tested. We now have over 92%, so 92.3% of all people over 16 have now received a first dose, and 81.6% received both doses. And I think that first dose coverage is a good indicator about what we're going to see overall, and we hope that number goes even further, because if 92.3% of people have got a first dose, we know at least that number hopefully are going to go forward and get a second dose. So we're well on track in New South Wales, and we are already a world leader in vaccination rates, and we really do believe that we can be the world leader in our vaccination coverage, which was going to be really important for us as a community in continuing to live our lives safely with COVID into the future. We're also seeing really good uptake in our 12 to 15-year-olds. So 75.5% of all 12 to 15-year-olds have received one dose. So again, really remarkable increase in the shorter time that 12 to 15-year-olds have broadly had access to vaccination, and 38.2% are now fully vaccinated. So really important for our 12 to 15-year-olds to keep coming forward for vaccination. A really important aspect of making the return to school as safe as possible to reduce the risk of transmission between students, from teachers to students and students to teachers. So making sure that our vaccination rates in schools are really high. So thank you to all those families and those young people who've come forward for vaccination. In the 24 hours till 8 p.m. last night, we had 283 locally acquired cases, and sadly, we reported the deaths of 7 people. We detected sewage in areas without known cases, including in the Wagga Wagga area, Woolgoolga and Jerusalem. So people in those areas, please be extra vigilant. And indeed, people in all regional areas. We are seeing cases in regional areas, and particularly for people in the Hunter area. If you live in the Hunter, New England area, and we have seen an increase in case numbers in recent weeks there, we are a bit concerned about transmission in that area. So if you live there, please do be vigilant for symptoms. Please get tested. Please get vaccinated. So that's probably all from me, Jess, at the moment. Thank you.
Thank you, Dr. Gale. We have a question, and we'll start off with the questions with Dr. Bushra Al-Obeidi from the Iraqi Australian University Graduates Forum. Her question is, when will the booster dose be given to the frontline workers and the elderly, and which vaccine? Dr. Gale.
Oh, thanks, Jess. So we know that the federal government is working on these issues of booster doses, and we know that in recent weeks to have a third dose was advised for people who have conditions that has suppressed their immune systems. And I believe just today the federal government also indicated their intention about the timelines for extending booster doses to other groups of people, including the elderly and vaccinating in aged care, and we expect further details about booster doses or the use of third doses to be increasingly available in the coming months. So, and in terms of which vaccine, I understand that that's at the current time intended to be an mRNA vaccine, so Pfizer or Moderna, and that the TGA and our colleagues in the federal government are working on all those details and confirming that. So that's already available currently for people with suppressed immune systems. So I would encourage anyone out there to check the government websites around eligibility for that third dose. And if you do meet that, or if anyone that you know does, please do encourage them to go and get that third dose. So more to hear in this space, I'm sure, as we look at booster doses and what role they're going to have in our community going forward.
Thank you, Dr. Gale. And I guess that's a reminder for all of our media, multicultural media, to stay tuned to this to every week. And please, as a reminder, please put in your questions in the chat and we'll get them answered by Minister Ward and Dr. Gale. Minister Ward, there's a question here. What is expected from the community now that New South Wales has reached 80% double vaccination? And there is a lot of freedom, but there's a lot of community expectation as well.
Yeah, thank you very much. It's a great question, because we know with our pathway that we have set forward that we know once we were hitting the 70% and the 80% that we would be able to have more of those freedoms and be able to release some of those restrictions. So again, once we get to each of those, we've set out the pathway for more freedoms. So at the moment, now that we've reached the 80%, of course, you can have up to 20 people at your home, and that's in addition to children aged under 12. So if you've got some kids, they've got some kids, that's fine. It's 12 over 12, so 20 people over 12, and a maximum of 50 at outdoor gatherings, which is fantastic now. So we've increased those numbers. And also, importantly, the cap on outdoor community sport, which I was advocating for strongly, would be increased to 1,000. We'll also need to follow the rules. Just remember, it's always important to be COVID safe, and please keep vaccinating, getting that vaccination. I can hear the bells going off in the background, so I might just mute for the moment. Thanks, Jess.
Thank you, Minister Ward. A question here, Dr. Gale, is about when will the vaccine be offered to people, especially children under 12? Will they be offered soon?
Thanks, Jess. So again, our colleagues in the federal government who look at approving vaccines, and not just the vaccine itself, but also what we call the indications, or who it can be used for safely and at what dose. So that's all being considered, and there are studies ongoing into the safety and the efficacy, or how well the vaccines work in younger people. So at the present time, we're expecting that there will be vaccines or that advice will be forthcoming and a decision made about the use of vaccines for children under 12 in the coming months, perhaps early next year. So we don't have exact timelines yet, but we expect that will be in the coming months. And we look forward to making that vaccine available for younger people once we have that advice and final decision from our colleagues in the federal government in light of the latest scientific evidence about those vaccines in that younger age group. Until then, the best thing that we can all do to protect our young people and reduce transmission between young people and from young people to others is to make sure that the people around them, the adults around them, anyone over 12 years old, around younger children, are all fully vaccinated. And that's the best thing at this present time that we can do to protect our children.
Thank you so much, Dr. Gale. One of the things that's coming to mind right now is a lot of celebrations are going to be happening. Christmas is coming. What are the safe behaviors? Just as a reminder, what should we be doing to maintain and to make sure that we're all safe and the community safe?
Thanks, Jess. Look, in general, in COVID, and especially as we come into summer, a basic measure is that where possible, meet your friends and your family outside. We know that being outside in an area that is well ventilated is generally a safer environment than any indoor environments, especially if that indoor environment is small or may have ventilation that it's not quite as good. So one simple rule for everybody is that if you want to meet friends and family and enjoy the holiday period coming up, wherever possible, do things outside. It's safer. Other measures are things that we talk about all the time, and that is, and again, they are basic, but they're very important and we know that they work. And that is maintain your distance from people. So wherever you can, keep that 1.5 metre distance away from people. In line with the roadmap, wear masks where masks are advised. So again, that's another important measure, and particularly in indoor settings until we get those vaccination rates even higher. Hand washing and hand hygiene is very important. And very importantly, if you become unwell or you feel unwell, it's really important to not go out and about, not meet other people. It's important to get a test. So those same messages apply to get a test and wait for your result. So very simple and basic messages, but they're the key things to do to enjoy the period ahead safely with family and friends. And of course, one of the big things that will reduce your risk and the risk to the people around you is, of course, vaccination. So if you haven't already got your first dose or you haven't yet got your second dose, I'd strongly recommend that you do that, especially in the lead up to the holiday period ahead.
Thank you so much, Dr. Gale. Minister Ward, are you happy to chat?
I'm very happy to chat, but I think the bells are still going just for a minute or so longer. It might be.
Oh, that's okay. So we'll come back to you later if you like.
I'll give you a thumbs up when they're finished. It might be just a minute.
Okay, thank you so much.
Thank you.
Dr. Gale, a lot of the questions surrounding intensive care and a lot of the people who are not, some cases of COVID-19 cases are in intensive care. What's the advice that we should be giving people who do have COVID and when they don't, when they're self-isolating in home isolation and they need medical advice?
Thanks, Jess. Look, a really important message for anybody in the community, whether you're diagnosed with COVID or not. If you're worried that you are feeling very unwell and you might be having a medical emergency, and that's particularly if you have symptoms like you have difficulty breathing, okay, or if you have chest pain or feel pressure in the chest, or if you have a severe headache or feel lightheaded. If you have symptoms like that and you have symptoms of COVID and you feel worried about your health, it's very important not to delay. You can call 000, call an ambulance, tell them that you have COVID or that you're worried that you might have COVID, and seek help. So that's a very important message. We don't want anybody to be staying home, feeling unwell, feeling worse and worse by hour or by day. We don't want you to do that. We want you to come forward and seek help. New South Wales Health, the public health system, will take great care of you. We have treatments that work. We have medications available, and our doctors and nurses in our hospitals are experienced now in treating people with COVID, and you will get great care. So it's very important, if you are at home and you're not feeling well, and you're worried that you might be quite sick or getting sicker, don't hesitate to call 000. For anybody who has COVID or it has symptoms of COVID or suspect they may have COVID, treatment is free. So don't let that be a barrier stopping you. If you think your symptoms are not very serious or you're just feeling mildly unwell, still it's important to check in, and you can either call the health team who might be looking after you or call your GP, or you can also call the number for Health Direct if you're just not sure what to do. But if you think it's an emergency, don't hesitate, call 000, seek medical help.
Thank you so much, Dr. Gale. Minister Ward, thank you for giving your thumbs up. A question about schools, and I think a lot of the people are concerned, and parents are concerned about.
I'm sorry to interrupt you, Jess. You can see they've just gone again. It's a very busy day. We seem to be having division after division. They stopped and I gave you the thumbs up, and then literally a minute later they started again. So excuse me, I'm so sorry. I will get to those questions, but it will be a couple of minutes. Apologies.
No problem. We'll ask Dr. Gale. Dr. Gale, some questions that the messages that we have to give parents, especially that children are going back to school. What should parents be doing with their kids who are unwell?
Thanks very much, Jess. Look, it's a very important thing as we go back to school, and it's really exciting to see kids and families go back to school. Really important that if your child is unwell, it's very important not to send them to school. They need to get a COVID test, and they need to stay home until they get a result. Very important, because it's as we go back to school, we need to make sure that we reduce any risk of transmission of COVID in schools, and particularly in our primary schools, where we have the vast majority of people who would not be vaccinated. And so we want to minimise any risk of transmission in schools and make sure that they're as safe as they can possibly be for our young people to be there and to learn safely. So really important message for parents. And I know that this can be an inconvenience and a problem, but it is critically important that if a child is unwell, they don't go to school and they stay home until they've had a negative COVID test, and they don't go back to school until they've got that test result and they're feeling better. Thanks, Jess.
You. Dr. Gale, thank you so much for that. In terms of the booster, and we said that already, and that's important for the immune, those who are compromised with the immune system. Do we expect that the booster injection happening soon, or is it a lot of questions are being asked about that, or should we just wait and see?
Oh, thanks, Jess. Look, I think that advice is going to be coming soon, and we're going to have certainty on that, I think, in the not too distant future. We know from experience overseas and from other countries, their experience with boosters, and all of that experience, we're lucky in Australia that we're learning from all of that. And that's all information that our experts nationally and the experts in vaccine nationally are considering. So they're considering what's the best vaccine, who best to give it to, how long after should they be given. And that's all advice that's already starting to come out for different groups of people. And there's going to be more information and more clarity on practically how people can access boosters in the not too distant future. So I'd suggest that if you are somebody who has a suppressed immune system, don't hesitate to look on the government websites to find out if you're eligible. And if you're not sure, talk to your GP, and I can let you know whether you're eligible now to have a third dose. And for other people who are older in age, keep an eye out, because there may be advice coming forth soon and more clarity about exactly who's going to be eligible for boosters, from when, which doses, and all of that other information is going to become more and more available in the not too distant future.
Thank you so much, Dr. Gale. Minister Ward, you're ready.
I am. I'm all here and ready to go, raring to go.
Yeah, some questions regarding community sport now that it's open, and education. What are the parents going to be expecting, and how can they be assured that it's safe, with community sport as well as in school?
Thank you. Yeah, they're both excellent questions, and I would say the same things apply. Our schools are ready and so well equipped. The Education Minister has done a fantastic job, but I just want to shout out all of those teachers, principals, administrators, and people out in schools are amazing at this. And so they're really robust in their plans, their COVID-19 safety plans for our students to go back. There is mask wearing in the classrooms. They're making sure that there's separate areas for students for various age groups to stay together so that they're not moving across campuses and between each other. They're really making sure that they've got those robust plans in place because they know their students so well. And I just want to thank all the teachers that have done such wonderful work and are really keen to get our kids back face to face, and have done so already with those younger and older ones. So those I have great faith in. my kids are back, and I'm really pleased that they can be, because that is the best environment for them. And I've got great faith in those schools to run those COVID-safe plans beautifully and execute them, and the students are amazing at following them. In relation to community sport, the same thing. The clubs, associations, and all of those sporting groups are fantastic at knowing their players, their registrants, the spectators, the parents, and everybody that goes along. And they're really good at understanding. They've done this before. Don't forget, after the last lockdown, they're able to make sure that everybody there is checking in, that they're wearing appropriately masks, and that they're outside generally, which is fantastic, and that they're socially distancing and following all of those guidelines. And so I welcome them, and I've spoken with them frequently, and their feedback is that they are ready, willing and able with their plans. They're good to go. They know what to do, because they want to keep their players safe. They want to keep their officials and their parents and their spectators safe. We want to keep everybody there so that they can continue playing, and we can have a safe season. We can finally get those boots on the grass and kick those balls around, so all of our kids can play, and all of our beautiful community sporting organisations that know their communities best can get out there and play again. So I've got great faith in them both. They've got COVID-safe plans. Of course, the community sport, that's for double vaccinated participants and spectators, and they will have caps of 1,000 for those, but we've got that up from 200. So I'm really pleased, and I thank Health for working so well with us on that, and I thank those community sporting organisations who are phenomenal at rolling these plans out.
Thank you so much, Minister Ward. We have a question from Iraqi TV from Hadil. Too many people contacted her regarding her information to help their kids who have autism 12 years and up, and they need to get the vaccine and they can't get it to like other children. Are there any procedures that you offer to get the vaccine in hospital for people with autism, children with autism, because some of them need to get it while they are asleep? Any recommendations, please, Dr. Gale?
Oh, thanks, Jess. Look, I know a number of our services, and I can speak for the New South Wales Health Services, are looking at and have already for many months now had some specific arrangements for people with autism, and also to arrange access for people who may live with other disabilities in the community, to make sure that vaccine options are accessible. So I would encourage those people making those queries to contact their local clinics to find out what arrangements could be made to facilitate vaccination for those children. Alternatively, I'd encourage them to talk to their GP as well. So GPs have a plentiful supply at the present time of vaccines, including Pfizer and Moderna and others. So, contact your GP and see what could be arranged. And similarly, also contact New South Wales Health Clinics. And I'm sure that options can be worked out. I know that many clinics already do have options for people who have specific needs.
Thank you so much for that answer, Dr. Gale, and I hope that answered your question, Hadil. Minister Ward, a question that a lot of people are asking is about places of worship and how important that is for the community at this time, especially for people from culturally and linguistically diverse communities.
Yeah, thank you. It's an excellent question, and I'm so grateful that all those religious and community leaders who've worked so closely with me and with the government to give us feedback, to give us guidance about what is important and what we can do to assist within the COVID guidelines and to keep everybody safe. And so I'm really pleased that we're able to open up. Obviously, that must be done in a COVID-safe way, and we encourage all of those groups to ensure that they're looking after everybody and following those guidelines, because it really is something that we have to take these steps carefully and slowly, as we've done, as we've gotten at the 70% and 80% mark. And so it's important that we keep those communities together, and we're observing the COVID-safe rules in relation to the square meterage inside, checking in and vaccinations. But really pleasingly, we know that for weddings and for funerals that those caps have been lifted. And so for those important observations that we make through our lives, that they can continue to be observed now that we can be back in person. And so I encourage everyone to, in their own congregations, in their own groups, in their own multi-faith organisations, that they are working together to support their communities and importantly keep each other as safe as possible.
Thank you so much, Minister Ward. And time has come now for 4:30 again, but thank you so much for joining us. So we'll just probably say some last words from Dr. Gale and Minister Ward. Dr. Gale?
Thanks, Jess. Look, Again, just a big thank you to everybody for all your efforts, and just a reminder that continue to come forward for testing if you have symptoms, and that applies even if you're fully vaccinated. So we know that many people in our community are now fully vaccinated, which is wonderful. But we know that people who are fully vaccinated can still get infected, even though their risk is less. And so it's still important, even if you have symptoms, to come forward and get tested. And so just otherwise, a reminder to everybody to enjoy the time with family and friends and being out and about, but please continue to follow the rules and do so safely and cautiously.
Thank you so much, Dr. Gale. Minister Ward, any final words?
Yeah, absolutely. Thank you, Jess. And once again, to all of the fantastic multicultural media outlets, you are as critical as ever, particularly as we emerge. We know that rules are changing, restrictions are easing, and conveying that information out in language in channels that are trusted, such as yours, is still absolutely, in fact, probably more so critical at the moment, so that we can let people know what the rules are as they change, what they can do, what they're able to do, and how they can get together safely. And I really appreciate everyone's great work, ongoing work, and we'll get there. And I really appreciate everything that you're doing as those restrictions ease.
Thank you so much, Minister Ward, and thank you for all the hard work you are doing. And of course, Dr. Gale, it just doesn't end with the key messages. And thank you to the multicultural media and everyone who's joined us today for our Multicultural Media Online Forum. Thank you for always being with us. Please send through your questions, even send them through email, and we'll try to get to you as soon as possible. If for any of the recording or any of these sessions that you'd like, please go to the New South Wales Multicultural Health Service website and you can find these recordings. Send us an email. Please visit newsouthwales.gov.au for more information and the restrictions. Please stay safe. Take care.